Hi, I'm Dr. Bethany Cannon.
And I'm Dr. Nikki Pearson. And this class is just a great way for you to start to understand exactly more about why you came into our office to begin with. And then we want to really bridge that gap in healthcare of where you potentially can go with chiropractic care. So we're going to have a lot of information about exactly how you got in this position and how it affects your health.
And one of the cool things that we find, practice members that come to this class really understand, like Dr. Nikki said, exactly how they came into the position that they are in, tend to really do the best and get the best results, which is exactly what we want for you. So we hope you enjoy.
So why are you guys here? Why are we in this class? There's so many things that we wanted to teach you guys in a report that's just absolutely not possible. Like, we can't go over how we ended up in the situation that we did, how it got here, how are you going to get the best result, all these different things. We don't have time for all of that because you were probably overwhelmed enough on that first visit. So we're here to really share with you guys all of those things that you can be doing outside of here. All of those things that got us in this situation, so you know exactly how we got here, so we don't ever end up in this situation again, right? I think you both all agree that that would be great. So you guys know, you guys heard my story. I don't know if you guys know, I had a major back injury when I was a kid, when I was 16, which is how I ended up in the chiropractic field. I'm a patient well before I'm a chiropractor. Before chiropractic, I went 6 months without being able to tie my shoe, touch my feet. I mean, I couldn't drive my car. I couldn't do anything. I couldn't even function. I had a major diving injury. I did a dive, and I landed back on top of the board, split my head open, and blew out a bunch of discs in my low back. And they wanted to do surgery and cortisone shots, and I couldn't do anything. And chiropractic is what got my life back as a kid, as a 16-year-old. So we're here, I want to share that with other people and teach other people. But the one thing that I didn't know was not only can it help with injuries, right? But there's this whole other aspect of chiropractic that most people don't know about. So I want to bridge the gap for you guys. I'm going to show you how, one, we're here to help correct your problems, right? Because everybody comes in typically with some kind of a challenge or a problem. But here's the other aspect of it that you don't even know you're going to get those benefits of when you're here during this time, okay? So we'll kind of go into both of those. The one thing that I kind of want to chat about is this small aspect of healthcare that chiropractic fits that nobody has any idea about. So what really is society lacking, okay? Is it prevention or early detection?
Either one.
I think early detection is we're getting better at it. Right, we can detect things earlier. There's tests to kind of catch things. You get your mammograms and all of those different screenings. All of those different screenings that you get early that can detect things early. But nobody really knows how can you prevent things. Cancer is just that big conversation right now. It's early detection and treatment, but really not preventing things. And so this is where we kind of fall in. Is we have this great niche about really preventing problems from happening, and that's what we're going to kind of touch on today for you guys. So what is the culprit to us getting sick? Why are people getting sick? What do you think is the causes that our bodies are breaking down or that we're having problems? What do you think? We have these genes, but our genes have not changed in 10,000 years. Our genes are exactly the same. What has changed is our lifestyle, right? And there's this thing called epigenetics. Now, epigenetics it's not just in the chiropractic field, this is in the medical field, okay? Epigenetics is, we have these genes, but our lifestyle choices trigger these genes to actually come out in us, right? To actually express this characteristic. So for instance, we can have the gene for high cholesterol, but unless we eat a diet that would trigger that gene, a diet that's unhealthy, or a diet that would kind of be the environmental spot for that gene, it's not going to trigger that gene. So that gene is only triggered if we make the choices that allow that gene to be triggered. Does that make sense? Are you guys following me on that? So that's one thing that's a little more empowering to you to know that, well, we don't just have to say, oh, our health isn't up to us, because we still can make those choices and still can make those we don't have to produce that environment to trigger that gene. Now, here are the environments that allow those genes to be affected most. So we could have, like we said, poor diet, lack of exercise, negative thoughts, stress. But the one thing we want you to know about stress is something very unique to your nervous system. And what's the first thing that we said that was important about your nervous system? What does it control? Do you guys know what the nervous system controls in your body? Everything, yes, everything. It controls everything. It is regulating and controlling everything that's going at your heartbeat. Every time our heart beats, that's controlled and regulated through our nervous system. How fast it beats, how slow it beats, the breaths we take, the oxygen getting to our muscles, everything is happening under that direct control of your nervous system. So if stress is affecting your nervous system, well, we want to talk about that kind of uniqueness and how it really affects your nervous system. So there's 3 types of stress, okay? Physical, chemical, and emotional. And we talk about that on your first visit, right? Those are the questions that we want to know. How is this pie in your life? How full is your pie? Okay, where are the biggest triggers and factors? Because they're all equal, even though I think that this bottom one is by far the most important. Okay, because that's the one that we deal with daily, right? So these are the types of stress that we're dealing with consistently. The one thing I want you to know is your health is like a 2-sided coin. Okay, one side of the coin are those 3 T's. We call these thoughts, traumas, and toxins, are the things that we're exposed to and we deal with every day. That's one side of the coin. The other side of the coin is the inability to adapt to stress. The cool thing is, what we do with chiropractic is we're going to make your body handle stress better. So yes, we have this one side of the coin that has these physical, chemical, and emotional stresses that we're dealing with, but the other side of the coin is, let's make your body handle those stresses a whole lot better, right? Doesn't that sound nice? Because those aren't going away, right? That's life. But if we can help your body handle it, adapt to it better, and process it without it having those negative health effects, well, that's what we're going to do. That's what we do. Now, one of those effects could be pain and discomfort, migraines, back pain, neck pain, whatever the case may be. I don't want to downgrade that because you're not going to hear us mention that as much in this type of a presentation, but just know that that's what we mean. Those are those effects that stress has on us, okay? So I want to kind of talk about the role of how the nervous system works from a stress standpoint. Okay, so follow me on this example here. We're sitting in this room, and all of a sudden we look over, and there is a bear sitting on that yellow stool over there. A bear, grizzly bear, stands up on its back legs, hands go up, and it's like chomping at its teeth to come after us, right? What is the first thing your body's going to do? Well, you're going to run. Yeah. Yeah, you're going to run, and exactly. And what is your body going to do to make you run? Because it's going to have to do something, right? Because you're not ready to run right now, right? No. So what would have to happen to make you run?
I don't know, it's just reaction.
Reaction, adrenaline. Okay,
Yeah.
Adrenaline, what else? Is your heart going to beat faster? Your eyes are going to dilate because we need more light to flow in to stimulate our brain to be able to know to run. We're going to be more alert. Probably not going to be very focused, right? We're going to be much more alert. We're going to put more blood to our muscles to make sure that we have the ability, they're oxygenated so we can run. Everything's going to change, right? Our whole physiology is going to change. So if we're looking at the sympathetic nervous system, that's that fight or flight response. It's going to divert blood flow away from your digestive system, right? You're not worried about digesting food if there's a bear that's going to eat you, right? Your body's not concerned with digestion. That's why we see people with high stress, and I'll get to that in a minute. It's going to inhibit your immune system, right? You don't need to fight off a cold if a bear is going to eat you, right? Your body's not trying to do that. It's not boosting your immune system. Blood flow is going to go to the skeletal muscles. It's going to increase your heart rate, your blood pressure, your blood sugar, the bad cholesterol in your body. Think of this, bad cholesterol in your body's sticky. So wouldn't that be beneficial to you if a bear is going to eat you, if your body's going to survive and save your life? If you're going to be in survival mode, that your blood's going to be sticky? Does that make sense? So your blood can clot, right? If he eats off your arm. So that's your bad cholesterol. That's made in the liver. Okay? A lot of people think that bad cholesterol is because we eat it. It's not. 70% of your cholesterol is made in your body. Your pupils are going to be dilated. It's going to sharpen the signal detention system, so reaction. But it's also going to, at the same expense, it's going to limit your concentration. The opposite systems happen with your parasympathetic nervous system. Remember that scan that we did where we're looking at where the little dot is? We want to know if it's on the left or the right side. Do you remember that scan? If it's on the right side, which I don't think anybody's is on the right side, but if it's on the right side, that's more of the parasympathetic nervous system working more. That's rest and digest. blood flow is going to go back to your digestive system, so you're going to be able to digest your food faster. It's going to go back and promote cellular-mediated immune system. Your immune system's going to work better. It's going to make your salivary glands increase salivation. That way you can digest your food. It's going to make sure that all of your reproductive organs work the way that they're supposed to. Because if a bear's chasing you, that's not a concern of your body. Right? So why am I telling you this? Why is this important? Because your body has one stress response, only one, to a physical, chemical, or emotional stress. One response, and it's the exact same. It is the sympathetic nervous system. It's the reaction you'd have to a bear, and it's always going to respond that way. It doesn't matter if it's a chemical stress, an emotional stress, or a physical stress. So if there's a bear, and you guys think you're going to be eaten, I just told you how your body's going to respond, right? What if you're on the phone with somebody, and you find out some really horrible news, God forbid, from like across the country, and you find out that news on the phone? What's going to happen? Are you going to have that same response?
Yeah.
Yes, because your body has one stress response. Do you see why we're telling you this? Why this is important? Because you need to know that every day that you have stress, that you're being running from a bear. Every day. Do you think after a while your body is going to get exhausted?
Oh,
Absolutely. That's why we see people first start with anxiety and then it moves into depression. And their adrenal glands, that's why women are just exhausted, because their adrenal glands are just fatigued, because we've been in fight or flight for so many years. Work stress, life stress. So what does that chronic stress response look like? Back pain. Because, and we'll kind of go into the exactly how that response happens, but headaches, asthma, adrenal fatigue syndrome, that's a common one we hear. Bowel issues, acid reflux, hypertension. Okay, didn't we just say that your blood pressure is going to have to go up if a bear's chasing you? If a bear's chasing you every day, your blood pressure is going to be higher, right? I just told you that the LDL is the bad cholesterol. You produce more of the bad cholesterol when you're stressed. Okay, 70% of your cholesterol is made in your liver. It's not eaten, it's made in your liver because of the stress response. Because your body's been stressed for so long, you're producing more of the bad cholesterol. So if we can get your body to stop responding to stress like that, do you think your cholesterol will improve? Yeah, we see it all the time. That's what we do. Because when we adjust you, we're going to decrease that stress response. We're going to get your body to adapt better to that bear, to those stresses that you have every day. That's our goal. That's why we check that heart rate variability to see how well is your body handling stress, because we're going to make it better. Well, we're not. Your body's going to make it better. We're going to just facilitate your body to heal. So that's why we do these scans. This is the thermography scan. This is looking for inflammation. Why do we look for inflammation? Why is this important? Because it tells us how stressed your body is, right? Because we know that when your body is when those blood vessels are dilated, so when you're in that fight or flight response, you're going to see more inflammation. If you don't see color on this scan, now this would be a good scan. This is a good response from somebody. But if you came in our office and you've never been adjusted and this is what your first scan looks like, that means that your body's just now chronically in that. The adrenal glands are so exhausted, they just give up. They're just done. They're tired. So typically what we'll do is we'll make it look like this until we can calm it down in a good way, right? We need to kind of wake up those nerves before they calm back down. This is a great picture because this is looking at the exhaustive patterns of your body. Think of it, when you're in fight or flight, when you're in that stress response, are your muscles going to be tight? You got to run from a bear. Your muscles have to be like ready to go, right? You got to run. So your muscles are going to carry more tension. So people always come in and they say, I have that tension in my shoulders all the time. I think I just carry my stress there. No, you don't. I mean, you might carry your stress there, but it's because your body's in fight or flight. It's not because that's just one spot your body picks. It's because you're like this all the time. You don't even need to be. You're not trying to be. You're trying to run. And this is it. This is the heart rate variability. This is the one we were just talking about, the most important scan we could do. How well is your body handling stress? This is a patient before and after. This is just kind of one example. Outside of the box, inside the box. Bad, good. The more variable your heart rate is, the healthier you are. Cardiologists love this scan because that's what they're looking at, and that's what they want to see in their patients. So I'll keep this pretty simple, but this is a study that was done after a chiropractic adjustment, and what they were looking at is, I'm just going to sum it up for you. Authors argue that basically the decreased sympathetic tone, decreased muscle tone, and decreased pain are all neurophysiological, interrelated, and initiated by a chiropractic adjustment. after an adjustment, your body comes out of the stress response. That's all you need to know there. That's it.
All right, so all the stuff that we talked about with how your body goes into a stress state, how your nervous system responds to stress, how does that relate to your spine? How does it relate to, kind of why you came into the office? So let's think about the postures that associate with that stress response. Okay, so the bear's in the corner, right? Okay, so what are we going to do if that bear's in the corner? What kind of posture do you think that we're going to have? We're going to be kind of open and relaxed and free? Not really, no. So we're going to be into this, fetal position, ready to fight or flee, and we're going to be in that kind of posture, okay? So think about your spine, up at the top and down at the bottom. So what we're doing to it is we're rounding it, okay? Kind of coming into this flexed position. Now think about the x-ray that we took of your neck, okay? How many people did we say that that curve isn't where it should be in your neck, okay? So this state of chronic stress that's on your body, that's how we get into this position over time. Over time, being in that stress response loses that curve in our neck and we come forward like this, okay? So that's how you got into that position where that curve isn't where it should be in your neck, okay? What happens with that is when we're kind of putting that, pulling or tractioning stress on the spinal cord, because we're putting into that nice C shape, what's happening is that produces a whole bunch of inflammation and tension on the nervous system itself, okay? So that's how that nervous system is stressed or interfered with, and that's how it can't respond and adapt well to stress, and it kind of is a vicious circle that, kind of leads forward and forward, okay? So we've talked a lot about the brainstem, okay? You hear us talk about that a lot, and I really like this picture over here on the corner. Shows the brain here, and in red, if you can see that, that's where your brainstem lies. Okay? Very important centers are located there, and overall that function of the brainstem, that's the last place in our body that modulates and regulates everything that's coming out of the brain and going out to the rest of the body, all the information that's going out of there. Okay? You can see in that brainstem that's actually located right at the level of the first two vertebrae in your neck. Okay? So that's why those two are so very important, because when those are misaligned or subluxated, as we call them, that puts direct pressure and interference on the brainstem. Okay? So that last, like I said, modulator, regulator of everything that's going on in your spine. All right? We also ask and talk a lot about mood. We find a lot of people that initially come into our office are dealing with a lot of emotional stress, whether it be anxiety, depression, various types of mood issues. Okay? So how we see that relate to your body, your spine, your nervous system is a researcher, her name is Candace Pert, she wrote a book, it's called Molecules of Emotion, and she was looking for, within the nervous system, brain, spinal cord, the whole thing, where are the most amount of concentration of opiate receptors. Now what opiate receptors are, when things bind to these opiate receptors, they produce kind of feel-good chemistry, okay? So that's where certain drugs are, have molecules that bind with those opiate receptors to produce feel-good chemistry. But that naturally happens in your body too. So she was looking for what part of your nervous system has the most, highest concentration of those. And what she found is right in this C1, or that top bone up at the very top in the brainstem, that's where the highest concentration of those opiate receptors are located. Okay? So that's how it has the biggest impact on things like mood, anxiety, those kind of things. If that brainstem is being interfered with, if there's pressure on it, no wonder people are feeling anxious, depressed, and have a lot of those mood type of issues. So that's one of the main things that people see change, after a period of care, of chiropractic care. This is a really cool study that was done specifically with the technique that we use in the office. That technique is called the torque release technique. And what they did was take the torque release technique and look and see how it was used in a population, basically of addicts. Okay, so they went into, you can see here, residential treatment facility of people suffering with addictions, and compared how they went through that process with chiropractic, specifically torque release technique, compared to just the regular kind of medical treatment, which would include a lot of different medications that they would receive. So the gold standard with this type of addiction population is what you want to get people to is go through the whole program. What they have the biggest problem with are people dropping out early. So that's where the retention rate comes in. With chiropractic care, the torque release technique, they had a 100% retention rate throughout the whole study. Okay, basically unheard of. The gold standard, what they really want to get, is up in the 70 percentile. Okay. So like I said, 75% compared with the placebo group, 56% with general policies treatment. That's the normal standard of treatment, like I said, medical type of care. One of the big things that they found in this addiction population is a decrease in anxiety and depression. So this correlates to decreased trips to the nurse's station. Why they would go to the nurse's station is if they had those anxious or type of anxiety feelings, they would go to the nurse's station in order to get anti-anxiety medication for them. Okay, so decreased trips to the nurse's station, proves that they didn't have as many feelings of anxiety or depression. So 9% with the chiropractic group, 56% with the placebo group. Okay, so very, very important, findings and studies there. And so they went through this whole study, and their conclusion at the end of it, and how cool is this? So this is the first research study to establish that subluxation correction improves state of well-being and allows for greater expression of human potential. I mean, who doesn't want more of that, right? So just a really cool study, and then you can see the references down here of where it was published at.
So, you guys have seen this chart. This is a chart I want to drill in your brain because we want you guys to be able to visualize that as we're working with those bones, we're affecting every single organ in the body. And the only place in your entire brain and spinal cord, the place that modulates and regulates everything is your brainstem. And that's right here, right around those top vertebrae in your neck. So literally, when we're working on those top two bones, we're affecting every other cell and organ in your body by those adjustments, because it's like the regulator. It's like the generator. It's like the powerhouse. It's sending out all the electrical power to all the other houses. It's like MUD. Is it MUD? No, OPPD, right? It's the powerhouse. It's where all the power is coming from, and then it has to be sent out to all the houses. That's your brainstem. Everything below it's just wiring. So that's why we want you to know when we're working up there, it's not that we're not recognizing that you're coming in with maybe low back challenges or issues in your leg. It's because we know that that's affecting every other part of your body, specifically those nerves that go down your leg. We want you guys to be empowered to know that too. The better choices that you make outside of here are going to help your care as much as possible. But again, the other side of the coin is we're going to help your body more adapt. We're going to help it adapt more to those stresses. So you do your part, right? The one side of the coin, you watch your stress levels, you watch what you eat, you start to move more, start to exercise. As you feel better, those are things that people can do, or if you feel good, start moving, right? But the other side is we're going to help you adapt more to those stresses as well. So we hope you enjoyed the workshop, enjoyed the class, and hopefully it helped answer a lot of the questions that you had coming into our office.
And if you have any more questions, feel free to stop and ask us at your next appointment. We'll see you soon.